Okay, so I think we're going to begin. We see more and more participants joining. Of course, we want to thank everyone for your time today. This is a very important topic we're going to be addressing, and we will, of course, want to wish you as well a happy Earth Day, something we celebrate around the world on April 22nd. So it's a very relevant day for our work today. Of course, we want to welcome you from around the world. We have two wonderful speakers today we're going to be giving the floor to in not too long. But first, we're going to talk a little bit about the Geneva Sustainability Center, talk a little bit about some of the services we provide, and how we're able to support you on your sustainability journey. And my name is Ryan Crowder. I am the program lead for strategic initiatives here at the Geneva Sustainability Center. And I just wanted to mention, of course, throughout the webinar, you may have questions. That's fantastic. Please feel free to ask those questions in the chat. We'll do our absolute best to answer those in a live fashion during the webinar. Should we be unable to address them, we'll be more than happy to do so over the next day or two. So please do send those questions in. We'll collect them. We'll find a way to respond to them and make sure that you leave here more knowledgeable around sustainability and more ready and confident to move forward on your journey. So I want to begin by talking a little bit about the work the Geneva Sustainability Center does. Our mission is really to equip hospital leaders with the information, tools, and skills to deliver a net positive impact for a healthy and resilient future. And for us, it's really important to look at a hospital as not, not a hermetic shell, not something that's isolated from the community. It's something that's actually very much directly involved with all community aspects of health, and really making sure that we work directly within our communities and provide a bit of a Lotus star, a bit of a North Star for sustainability and moving forward on that journey as we are. One of the things that we really work forward towards in our sustainability journey, and I just maybe ask for the next slide, if I please, Ken, is our work on a sustainability framework upon which all of our services, all of our work is developed on. One of the things you may notice if you're in the field of sustainability is that a lot of sustainability is done on a industrial or commercial aspect, a generic commercial or industrial approach. For us, it's exceptionally important to consider healthcare and sustainability in the specific requirements of healthcare. And you may notice on the screen here, while we take an approach that's similar to an ESG approach, environmental sustainable governance, we're also taking an environmental impact, health equity, well-being, and leadership and governance approach that's very specific to healthcare. And if I direct your attention to some of the subdomains underneath these domains, a lot of these are really specific to healthcare, and you need to really take into account the intricacies and complexities that are specific in our field. So for instance, if we're looking at low carbon care clinical practices, which you're going to hear a little bit about more today from Amina, one of our speakers, or health vulnerability assessments under the health equity and well-being area, it's exceptionally important that we consider the very specific aspects of healthcare sustainability and make sure we build those into our strategies. So this is the basis of which the work we're doing is originating from. Our work specifically is about directing services towards the various aspects of sustainability. And for us specifically, we're going to talk a little bit about action planning today. This is really about developing a robust strategy for your hospital so you can move forward confidently and with clarity. And that's just one aspect of what we do, though. We're really trying to be transformational. We're trying to help hospitals generate a really strong sustainability strategy, have the knowledge and the implementation capacity in place, and to move towards accreditation and certification. So just to give a little more information onto each of those, our capacity strengthening activities are really about our master classes, our carbon emissions learning lab, our simulation activities, really in, again, the service of bringing leaders to the table, making sure that they have a uniform understanding of sustainability that they can then build onto as they move forward. The global collaborations aspect, we work with public organizations, private organizations, international organizations, all kinds of organizations and associations, all in the service of moving sustainability forward. And one specific aspect of that we've had a really great success of in the last little while is our work on accreditation and certification. So because we work with Joint Commission International and a variety of other accreditation bodies around the world, we're making sure that we're establishing benchmarking on sustainability that needs to be done for hospitals no matter where they are in the world, but at the same time also providing stretch goals. So for certification for hospitals that are really looking to move forward on their journey at a higher level, to move forward in a more advanced fashion, really we're providing that aspect as well. So we're trying to move up and bringing all ships up, but also providing stretch goals for those hospitals. And lastly, as what we're going to talk about today is our action planning work. And this is really about the Sustainability Accelerator tool. And if I could, I just ask for the next slide just to talk a little bit more about that. So the Sustainability Accelerator tool was developed over the last several years. We launched a few years ago as well. We're continuously advancing and developing it. It's really a tool that provides a strong understanding of where you are first on your sustainability journey. Many hospitals are just beginning on their journey or they're maybe quite advanced. But what they find more than anything is that there's actually a very broad and wide scope of sustainability. As you remember before showing the different domains of sustainability as we understand it, it's exceptionally important to understand how you're doing on each of those areas, each of those domains and subdomains. But at the same time, then building a comprehensive sustainability strategy that you can be, proud of, and also one that can be easily integrated moving forward. So the tool it's a SaaS tool based online. It's developed for C-suite and senior hospital leaders, as well as executives of governmental and public healthcare organizations. And it really enables leaders to not only develop that sustainability strategy, but also prioritize and understand what are some of the initiatives we need to take into account. Look for some quick wins at the beginning, but also some medium and longer term stretch goals that can really enhance our profile, and working not only towards sustainability, but also quality of care and operational efficiency. We don't believe those are divorced aspects of concern. It's exceptionally important to make sure that the quality of care only increases over time, as it often does with more sustainability initiatives, and at the same time, improving operational efficiency. And what we're talking about here really is about cost savings. So it's a fantastic approach to cost savings to integrate sustainability. It's often a misconception, in fact, that some of the work that's done around sustainability is usually a cost center, or it's going to be costing us more money than we can afford at the beginning. And in fact, actually, sustainability is a very large driver of cost efficiency over time. And last of all, as mentioned before, the Sustainability Accelerator tool really provides that impetus towards achieving accreditation standards and certification longer term. So really not only aligning you up with the accreditation standards that may be required in your jurisdiction, but over time also understanding a little bit more about what needs to be done as more sustainability standards come into account and into play, and the certification becomes more relevant and more required. So therefore, you're going to get ahead of the game by using a tool such as this and moving forward on that journey. I'm going to just show you one more component of the tool before we move forward with the presentations today. The first aspect I just want to mention is the tool is really broken into two parts. The first part is the maturity assessment. So that's a 56-question self-assessment. Again, really what this allows you to do as a hospital is understand where you are in your journey. And that's oftentimes quite a revelatory moment. A lot of hospitals think they're doing quite a bit better on some areas, or maybe think they're doing worse on areas they're actually doing quite well. So this activity done across your organization really helps to feed a general understanding of where you are. And from there, already you're going to start to get benchmarking against the hospitals around the world that are using the tool. We have hospitals in more than 26 countries around the world. And on top of that, we also are going to give you recommendations to improve and meet those at exactly the area you are at. So for example, if low carbon care clinical practices, you're doing quite well, you're at an intermediate level, how can I advance that further? What kind of steps can I take into place? And how can I prioritize those with respect to other sustainability actions? On top of that as well, we also add a performance dashboard. Again, a really nice approach to streamlining and consolidating all your performance on sustainability. We know that sustainability can be quite complex, quite fragmented, particularly for hospitals just beginning on their journey. This allows you to consolidate a lot of those activities, looking at this in one area, looking at the core indicators that you need to look at to ensure that you're progressing on your sustainability journey. And again, allowing for that to inform your next steps going forward and aligning your team. So it's really a wonderful tool. It's really been taken up very well from single hospitals to systems to associations around the world. And we do strongly recommend you consider it for your hospital. Before we go forward to our presentations, we're going to do a short exercise. We're just going to learn a little bit more about you and understand a little bit more about how your journey is going forward. So we have two questions for you. If you've used Mentimeter before, you'll know how this works. But it's quite a simple approach. What effectively will happen here is my colleague Renzo was going to share in a moment the screen to allow for the questions to be answered. And the first question here, you can do one of two ways of doing this. You can either use menti.com at the top here and put in the code provided, Alternatively, you can quite easily scan the QR code with your phone, and this will allow you to answer these questions. And the first question we're going to look at here is, which of the following sustainability areas has your hospital taken action on? Please take a look. Please consider this about what you know about your hospital right now. Where are some of the areas you've taken action? You may have already done some work on electricity savings or water reduction, use of water reduction, reduction in water use, I'm sorry. You may be working a little bit towards procurement and supply chain. Maybe you're already tracking some of your processes. You'll notice that all six of these, this is far away from being exhaustive or a comprehensive look at sustainability, but it does provide you a very good understanding about where some of the gaps may be already in your work. So we'll give you, you can see excellent. I mean, generally speaking, use of environmental resources, a common area of work that's been done. Generally speaking, actually, this is usually something that's a bit of a sleeper sustainability job because oftentimes, or task, because oftentimes hospitals undertake this and don't think about this as a sustainability activity, but in fact, it's very strongly sustainability oriented, particularly around waste and electricity consumption. So very important that that work is already being done. At the same time, employee engagement and empowerment, excellent to hear. So I hope there's some work done on communications, finding ways to make sure that there's empowerment of employees to move forward on sustainability within the particular areas. Interestingly here, addressing the social determinants of health. You may not even know what exactly that's referring to, and that's helpful because that will help you understand that there are other aspects of sustainability that may be important for your hospital. Same with infrastructure and service resilience and procurement and supply chain. Again, areas which are maybe a little more difficult to address in a simple sense, and where the tool will actually help you build an understanding where you can move forward. Lastly, tracking and reporting processes. If you're not tracking and reporting, it goes, as the old adage says, if you're not measuring it, it's hard to improve it. And that's why we've developed this tool to provide a simple way of tracking and reporting. What is the biggest challenge you're facing in progressing your sustainability strategy? We've talked to hospitals all over the world now, and we find that there's a variety of different chief challenges or obstacles that are being faced. Some of these are a lack of data and measurement. Others are difficulty prioritizing actions, resource constraints, lack of a clear roadmap, and limited leadership alignment. So please, I believe we're having a 3-answer limit here, but try to take a look at what are the most important for you that you're currently facing, and then we'll show the results as well, if you don't mind, Renzo. Thank you. Excellent. A classic adhering to the issue of limited leadership alignment. That's really what our Geneva Sustainability Center's masterclasses aim to address, to make a uniform approach. Much the same with the reporting and the Sustainability Accelerator tool, allowing for a clear road mapping as well and a lack of data measurement to address that. Difficulty prioritizing actions, excellent point as well. I mean, it can be very, very difficult. It can be very complex as well to decide between different parallel tracks and which ones should be done in parallel, in fact, as well. And lastly, resource constraints, obviously areas around financial issues, human resource issues, the inability to deploy talent when needed. So again, you're seeing difficulty prioritizing action, a lack of clear road mapping, increasing a little bit here. But again, all of these aspects can be addressed by their tools, either through the Sustainability Accelerator tool or our masterclasses and training leading up to our accreditation and certification, again, providing you that benchmarking to move forward on your journey. So thank you very much, everyone, for your participation, those who were able to. What we'll do now is we're going to shift over to our first speaker, and that's Miss Amina Mahmood Ahmed, who is a leader in sustainability. She's working and specializing in quality, excellence, and sustainability. She's the head of quality and excellence, in fact, the department of that, and the head of sustainability at Fujairah Hospital in the UAE. Amina drives transformational activities and initiatives to enhance patient care, operational efficiency, and environmental sustainability. She's currently pursuing her PhD, so we're excellent to get her away from the books for a little bit here, and working on assessing the environmental impact factors of clinical operations in the UAE healthcare system towards a standardized greener framework again. And again, beyond quality dimension, Amina champions sustainability in healthcare with the recent research in barriers and enablement of environmental sustainability development and the role of leadership, quite appropriate, I think, given what we just saw in green behavior in Fujairah Hospital. She's also led the future foresight strategies and developed 3 strategic scenarios to advance sustainable healthcare practices. So I'll turn it over to you, Amina. Thank you so much for being here today.
Thank you very much, Brian, first of all, for your kind and very comprehensive introduction. Welcome everyone. It's fantastic to see everybody joining us today in the Geneva Sustainability Center. And I'm so much excited to dive into this very special topic, which is to me very special to my heart as well, and to explore some of the valuable insights together. This gathering actually reminds us why we choose sustainability, because healthcare is not just simply a service, it is a promise. With you again, I'm Mahmood Ahmed from Sustainability, Head of Sustainability at Fujairah Hospital, United Arab Emirates. To start off with, I'd like to take you through a short sustainability journey of Fujairah Hospital. So, Renzo, the video, please.
استدامة أثر في كل نسمة هواء نشمه. كل هذا في عقول صانعيها يوم قرروا تكون لهم هذه الروح اللي استلهموها من رحلة ابتداها أبونا زايد، واليوم مستمرين على نهجه أصحاب الطموح. أنت مستعد تكون جزء من هذه الرحلة؟
Okay, so I hope everybody enjoyed the video. Just briefly about what it said in the video, that sustainability actually is every breath that we take. And it is not something new, it is from our forefathers, what have been teaching us to be sustainable. So this is what it said in Arabic. So thank you very much for watching that video. I want to open today's session with a question. And I'd like everybody to think about it just for a moment. What does it truly mean to deliver health equity, not as a policy aspiration, but as a daily lived reality for every patient who walks through our door? Okay, so at Fujairah Hospital, we chose not to answer this question with words, we answered it with actions. Over the past years, we have been designing our services according to the patient needs and demands, and of course, with a focus on patient-centered care and outcomes. The bond between sustainability and health equity and well-being was not very clear to, I think, all of us in a structured way until we conducted our first maturity assessment by sustainability Geneva Sustainability Tool SAT dashboard, which actually really highlighted the main areas that needed to be tackled and integrate the health equity and well-being and sustainability measures. I think in the activity that we had done a while ago, Ryan, you can see that social determinant of health, I think it just scored a point or so. So here it's very clear that this domain is very important to shed more and more light upon it. So from here, we embedded equity into the very architecture of how we deliver care at Fujairah Hospital, not for a segment of our population, for all of it, including those who could never came to the hospital, which because it's either far or out of their reach. Today, in the next 10 minutes, or I suppose I have 8 to 7 minutes left, I want to share 3 main things that with you. What we built, what we have achieved, and why it matters for your institutions. Okay, as you can see on the screens, we have two main projects that we conducted in our Fujairah hospital. So the SAT dashboard gave us really the architecture of not just measurement framework. It mirrored that the shown institution exactly where it stands and exactly where it must go. So at Fujairah Hospital, we accepted the challenge, and today we are proud to report that we have reached the advanced maturity level in with the SAT indicators, one of the top performing hospitals, which been assessed under a SAT framework. So everything was built rest on three pillars. As we know in the SAT tool, we have three main domains, and health equity and well-being was one of the pillars or domains that I'd say was very important to us. And we wanted to make sure, first to start off with, it was kind of a bit challenge to us. We were thinking, oh, okay, so we need to really define our vulnerable population. We need to really have a policies, and we need to really. But after assessing that, assessing ourselves with the SAT tool, it really gave us a clear framework of where we should be heading and what we should be doing. So health equity and well-being, which ensuring no patient has left behind regardless of the age, mobility, or the circumstances. The other area that we concentrated on was proactive service delivery, which is moving from reactive treatment to anticipatory door-to-door delivery of the care. And the third pillar that we concentrated after we conducted our health equity and well-being assessment was the environmental sustainability, because hospitals that harms the planet cannot truly serve the purpose of its services and to the health of its community. So these are not separate programs, they are integrated strategy. The SAT dashboard, what it does, it made them measurable, accountable, and scalable. As Ryan said earlier, if we are not measuring it, we're not monitoring, we cannot measure it, and we cannot improve it. Again, I'll back to these slides, and the teleconsultation and medication home delivery. I'd like to give you short stories about Fujairah Hospital's patients or customers, and then I'll come back to the numbers on the screen. So I wanted to introduce you two people. The first is a 78-year-old lady who's living alone in a district 40 minutes away from the hospital. She is a chronic condition. She needs medication every month under old model. She would need, of course, somebody to bring her, drive her to the hospital, get an appointment, wait, queue, return every single month just to get her medication. The second young man is with a disability, a person of determination. In our national terminology, we call them person of determination. He has never missed an appointment, but the effort it cost him to get here is immense. So we asked, what if hospital came to them? After asking that question, we came up with a really impactful services, which is a teleconsultation integrated with home delivery of the medication. So we launched the proactive home delivery of medicines, and of course, a teleconsultation followed by medicine delivery for elderly citizen and vulnerable population. With zero requests required from the patient. The hospital identify them, the hospital reach out of them, and the medication arrives at their door. So we can see now the results speak from themselves. More than 6 million minutes saved for the patients which are vulnerable, time returned to their lives not spent in the waiting rooms. 40,000 plus in-person hospital visits were eliminated, reducing the strain on clinics, pharmacy, and staff. 50% reduction in the number of the steps required to access the care through radical simplification, and 29 plus million dirhams in economic value added to the efficiency gains and reduced resource wastage. So all these big numbers, and of course, in finally, the more than 4 million tons of carbon dioxide emission were avoided. Because of fewer journeys to the hospital mean a cleaner city. So this was the first, and at the bottom of that, if you can see the bar graphs, which shows really how we've been measuring this carbon reduction of the telemedicine and home delivery since 2022, but we weren't really integrated it as a pillar of sustainability. as equity and well-being. Another example on the right-hand side is another initiative that we came up with, which is called We Are Here For You initiative, which is our second major initiative, which takes, again, personalization even further. Virtual consultation, accelerated medical reports, nutritional supplements, and medical supply that is required by the patients is delivered to the patient home without being present at the hospital. So again, full proactive model been around the patient's life, not around the hospital schedule. Again, the results, 32 million minutes saved annually from our patients from getting these services, 54,000 plus in-person visits replaced with digital proactive alternatives per year. And of course, the satisfaction reached up to 98% from the patients, because the highest validation we could receive. 2,200 plus beneficiaries received these nutrition supplements and medical supplies directly at their home at their ease. One of the last example I'd like to share with you that had a very great impact on the community, on the equity and well-being of the patients, is that we just didn't wait for the people in our hospitals or in our facilities. We reached out to them through the community volunteerism. Finally, what happens when a hospital commitment inspires its community? So last year we had more than 10,000 volunteer hours logged, and as we transformed individual acts of generosity into institutionalized community care ecosystem. Because sustainability in health is not only environmental, it is social. And this is what we have learned from SAT dashboard as one of the main pillars and main domains. I'd like to share some of the results that we had from the SAT dashboard, which didn't just allow us to simply tell a good story, it demanded that we prove it. On the left-hand side, as you can see, our assessed maturity scores of the critical domains, which comes under the health, equity, and well-being. The blue one is the benchmark, which is in the system. The orange is our first assessment result, and the third bar is our current assessment result. You can see the improvement that we have done by conducting and by following the action plans that were suggested from the SAT dashboard and so on. So these were the impactful results that we had. Again, a few of the results that I am happy to share, that 96% of the environmental impact, actually, we even across the benchmarks, we looked at our supply chain infrastructure being redesigned for low carbon future. 95% on the low carbon clinical practices. We had an evidence that sustainability reaches even into the clinical pathways, not just in our administrative services, let's say, and 87% on health, equity, and well-being were above the benchmark in the domains, as we committed to grow even further. And on the right-hand side, I'd like to share a few of the current to future plans that we have and they are currently undergoing at Fujairah Hospital, from full life cycle analysis of the medical equipment to integration with the national EMR digital platform from real-time device monitoring. These are not just the pilot projects, they are undergoing institutional commitments. Okay, and I'd like to leave you with this. Health equity is often discussed in policy documents or in conference halls. At Fujairah Hospital, we asked a different question. What if equity was not a target, but default design of every service we offer? Again, thanks to the SAT dashboard, gave us the framework, our team gave it life, and our patients, an elderly woman receiving her medication without ever leaving her home, and the young man with a disability treated with a full dignity, they gave us the reason. We did not wait for the perfect system. We built one patient, one initiative, one data point at a time. The results you have seen today: 6 million minutes returned, 29 million dirhams value created, more than 4 million tons of carbon dioxide avoided, and 98% patient satisfaction. These are not ceiling of what is possible. They are the floor at Fujairah Hospital. So if you are leading hospital anywhere in the world, I would invite you to ask your own version of your own questions. Who are we not reaching yet? And what would it take us to reach them? Not someday, but now. You have to start from really now. The SAT dashboard is one of the powerful tools at that journey, and we are living it and proving that it really works. So to end with, thank you and shukran in Arabic to all the International Federation and Geneva Sustainability Center, and to everyone of you for your time and commitment towards the better healthcare. We are proud to represent Fujairah again in the south coast of UAE, and believe that hospital's greatest achievement is not the care it delivers inside its walls, but the lives it transforms beyond them. Thank you very much, and I'm happy to take any questions. I think it's back to you, Ryan. Thank you.
Thank you so much, Amina. Incredibly inspiring. It's not only story, but weaving that in rather to your overall strategy. So thank you so much for that wonderful presentation, and very, very appreciated. Just given the time, we're going to have to move relatively quickly to our next presentation. Mr. Andrés Alvarado. Andrés has over 25 years experience in facility safety and environmental management, and more recently in quality and sustainability. He has supported strategies to reduce the environmental footprint as part of the United Nations Race to Zero campaign in collaboration with the Global Network of Green and Healthy Hospitals. In addition, he also serves as an auditor in carbon footprint verification processes. He's currently serving as the Quality and Environmental Manager at Clínica Bíblica in Costa Rica. Andrés, go right ahead.
Okay, thank you so much, Ryan. Good morning and good evening, depending on the place where you are right now. As Ryan said, my name is Andrés Alvarado. I'm the Quality and Environment Manager in Clínica Bíblica in Costa Rica, which is a very small country in Latin America. And I am going to speak a little bit in a few minutes about our sustainability strategy. So we can go ahead to the next slide, please. Here you can see our three facilities. The first one on the left is our main campus in central San Jose Bar. And the one that is in the center part is Santana facility. And the other one to the right is Al Este facility. All of them are constructed in 100,000 square meters. So our hospital in our country, which is very small, is big, you know. At the same time, I want to show you this roadmap of accreditations and recognition related to quality and environmental issues. First one in 2007, our first accreditation by JCI. And then, for example, in 2012, our first accreditation related to carbon neutrality program in Costa Rica. At the same time, for example, we joined Race to Zero in 2021 because we are working with some decarbonization processes in our hospital. Very important, in 2023, we start our journey with the Global Reporting Initiative, making these reports. At the same time, in 2024, we're starting by reviewing the IFRS, which is a standard related to the financial issues. And finally, in 2025, we start with CARE, which is another great program related to the carbonization processes as well. Okay. Here we have our two reports. We only have two reports at this moment. The first one from the year 2023 and the second one from the year 2024. And as you can see on the left part of the slide, we have the Global Reporting Initiative and the IFRS. I want to speak something. We have been working this assessment under a dual materiality approach. Related to the Global Reporting Initiative, we are making this assessment speaking about the impact materiality, which is related to the stakeholders. And on the other hand, we have the IFRS standard, which is related to the financial issues related to the impacts for the operational system of our hospital. And to the right, we have the first materiality assessment that we have in our hospital, consisting of 30 material topics. These are related to the Global Reporting Initiative standard. And at the same time, we have 24 impacts. Some of them are positive and some of them are negative. You can see here, for example, the green ones, which are related to the environmental area, the red ones, which are related to the social area, and of course, the blue ones, they are related to the economic area, all of them related to the governance of the hospital. And at the same time, we have been working from 2023 till the year 2030 with 29 commitments. For example, in wastewater, even though we comply with currency legislation, we have been working in order to go further, to have a treatment for coliforms in our hospital. Speaking about energy and emissions, we have been working from several years related to decarbonization processes. For example, we have 21 solar panels in order to heat water in our hospital. At the same time, we have 228 PV panels in order to have electricity from renewable resources. We have been working at the same time with the reduction of anesthesia gases. For example, last year we prohibited the use of nitrous oxide, which was a very good step for us. At the same time, we have been working with low flows in the use of Seurane and Deslorane, and this kind of projects. In the waste area, for example, in the last year, we have been working with a supplier here in Costa Rica in order to reuse at least 150 tons of construction waste in order to reuse it, not to send them to the landfill. And this is very important in Costa Rica because we have several problems with the landfills in our country. So this was a very good decision for our hospital in order to reduce our impact in the landfills. Speaking about the social areas, for example, in the patient safety and experience, we have some indicators that are interesting to understand. For example, the Net Promoter Score, which is related to the loyalty of our patients. For example, in 2025, our score was 69 and our goal is 75. So we have been working so hard in order to increase this score. In community well-being and development, for example, we have a very good program, which is called in Spanish, Programa de Acción Social. This program is a very interesting program in order to bring services to people who have low resources. In our country, for example, we have two mobile mammographies in order to go to every place in Costa Rica to give them this service for free. Working about workforce management, for example, we have our staff turnover. In 2025, it was in 12%, and the goal is like 10% because some hospitals in Latin America have this score. And of course, we have been working with contractor safety, employee health and safety, all the occupational health activities that we have to take care as well. Of course, the information security, this is another of our material topics, these things related to cybersecurity. And at the same time, we believe, because right now we have been working with the financial materiality, that this could be one of the issues that could be considered a material topic, not only for the impact materiality, but also as well for the financial materiality. And of course, finally, our blue ones, the climate change, because as I told you, we have been working with several activities in decarbonization in our hospital. At the same time, we have been working with value change. This is very important. Speaking about, for example, scope 3 in our carbon neutrality carbon footprint. We have been working, for example, with sustainable procurement of supplies. Last year, we started this program. And of course, governance and ethics. Can we go to the last slide, please? Why are we working with sustainability? As Amina said, we have the same answer: create value. We think that working with sustainability is a good way to create value in the hospital. I think this is the main idea here. And sometimes the people is considering the money, the quantity of money that we need to implement these activities. But anyway, it is important to understand that we need to create value for the hospital. Speaking about SAT, the Sustainability Accelerator tool, which is the framework from the Geneva Sustainability Center, I think is amazing. We have been using this tool the last 2 years, and it has been an important tool, not only for assessing our hospital's level of sustainability maturity, but also for launching processes to compare, as Amina said, the ESG indicators. For example, in our case, our sustainability maturity for 2025 was 53%. So we have a lot of things to work or to do to increase this percentage. What challenges arose in this case? First of all, as I told you, the thing related to the board, the support from the corporate management. They support us very well, but as I told you, the first question was, what about the money? What about the resources that we need to implement these activities? But as I told you, they support us very well, and we have to present these indicators every 3 months to the board. And of course, the training for all the staff. Right now, we have almost like 1,600 people in our 3 facilities, and I remember that last year we can train at least more than 1,000 people. So this is very good because to implement these activities, it is important that all the people understand the standards, the concepts, and these kind of things. And of course, the initial engagement of stakeholders. We made a survey with all the main stakeholders in order to understand their needs, in order to implement the program. Of course, the results of this initiative, as I told you, a very clear roadmap with 29 management commitments through the implementation of these 13 material topics. And the next steps, right now, we have been working with implementation of IFRS S1 and S2 standards to assess financial materiality. This will enable us the development of a dual materiality roadmap, ensuring operational resilience. For example, last year, we have been working with some improvements related to our power plants, because by the risk analysis that we made last year, we consider that in Costa Rica we are going to have more heavy rains and some adverse events related to the weather. So it is important to understand that the resilience is clearly an important issue in the hospital. In a hospital, you need electricity, water, and oxygen, and we are now working with this first adaptation plan related to electricity. So that's my presentation. Thank you so much.
Thank you very much, Andrés. Excellent work, of course, and thank you very much to you both for the wonderful work you're doing on sustainability. I want to just reiterate the point you mentioned, specific to the question about money and financials as well, and the cost savings that you've illustrated across both of your activities and also Amina with respect to the telehealth are really immense. And I know you might have actually been too informative because we don't have any questions so far, but we'll wait a second here and see if anyone has any questions. And if you do, please put them into the chat. We're also going to add here as well a link which you can use to learn more about the Geneva Sustainability Center's Sustainability Accelerator tool and understand how you can do a free demo for your hospital and also learn a little bit more about it on a private call as well. One question I would have, and if there isn't any questions as of yet, that I would like to address for both Amina and Andrés, if you'd like to address it, would just be with respect to the challenges you face. Now, Andrés, I know you mentioned a little bit about some of the challenges you faced, and it was a little bit financial. I was curious if Amina, if you found the same way, and if Andrés, if you could expand on that in any way about some of those challenges, how you overcame them, and what could be done about that. So I'll give the floor to Amina if you have anything you'd like to add to that, and then we'll move towards any other questions that may arise. So Amina, go right ahead, please.
Right, yeah. So thank you for the question, Ryan. I'd like to say, or I think it's my belief or our leadership belief, and we shouldn't take the finance as the first pillar of implementing the sustainability initiatives, because if we're going to think about it, it's going to stop the idea, is going to, just kill the culture of the sustainability. So we took it the other way around. Let's see what we have, what resources we have, what we can do, and let's leave the things that would need big finance to the end. So we took the small steps, incremental steps, which really led us step by step to implement what we have and what we could do in our capacity. In this way, we didn't face the challenge that finance was the challenge. So we took advantage of what we had around us, what resources we had, and we turned it into sustainable initiatives rather than starting with the hard ones. So this is what, yes, with regards to the challenges, we would say, of course, there is challenges in implementing any new strategy, especially sustainability is being looked at in the healthcare as something different or something separate apart from the healthcare. It shouldn't be a physician's job or nurse's job to think about sustainability. So this was, I think, our main challenge, the knowledge and the culture to change that. That took us a time, but as I said, with small incremental steps, there is a cultural shift in really accepting and adapting and adopting the practices of sustainability. So I think we're at the stage now that the people have really coming, forward and advising or giving us idea about what we can do to be more sustainable. So which is really great.
It's a fantastic answer, and especially about the incremental components of moving towards behavioral change needed to bring in sustainability online. Andrés, if you'd like to address that, we also do have one question, so go right ahead first, and then we'll get to this question.
Okay, no, I think that as the same as Amina, that in this case, if we start to make this assessment related to the financial materiality, it could be so nice for us because we can demonstrate to the board the importance of the sustainability, not only related to the impacts, but also as well related to the financial issues.
Oh, fantastic. Very well put. Sometimes it's a matter of reforming that and obviously influencing up and just making sure that we bring our hospitals on the right journey and considering the right indicators for that. Very well put. Thank you so much for that. I just want to ask the one question that has been asked, is a very insightful one, and I do thank you for your presentations, but is how does your hospitals create meaningful opportunities for patients and communities to provide feedback on your sustainability efforts? So how do you connect with your communities more widely around sustainability efforts? And is this input used as a success indicator within your overall sustainability strategy? It's an excellent question. Amina or Andrés, do you have any feedback? Amina, yeah, go right ahead if you'd like to.
Yeah, I'd like actually to answer this question because our belief in Fujairah Hospital, as we said, you cannot clap with one hand. And sustainability cannot be done just behind the walls, as I said, behind the hospital walls, and you leave the whole community out there without knowing what is sustainability. So what we have done, we have a big yearly plan of sustainability initiative to the communities. As in the videos, I think you might have seen that there's something called Sustainability Council, which is really a council set up outside the hospital in the community halls to gather everybody and tell them what we are doing as a hospital and what is your role as a community to be together with us to improve the sustainability in our country. So this is how we are reaching out to the people to really spread the message, not just for the hospital staff, but to the community, because they are the one who is going to make big difference together with them.
That's fantastic. I think we'll take that analogy forward about the clapping as well with respect to sustainability. Andrés, if you'd like to go ahead.
Yeah, the same. It is so important to understand the needs of the stakeholders. For example, we have made some meetings with them in order to understand their needs. This is the clue, we cannot do sustainability only by ourselves. We need to understand their needs, and we need to consider this as well related to human resource, to human rights, and this kind of issues as well.
Excellent. So, and I understand as well that sustainability on the side of continuously operating within the community and making sure that there's continued operations happening. I guess, Andrés, there's a connectivity always, and to the question's point, that's something that's always been brought back in and fed back onto your processes.
Exactly. And at the same time, we need to address the due diligence processes as well, which is another key issue here.
Yes, certainly. Thank you very much for that. I think we'll have to close the session in a second. We have little other questions. So obviously the two of you have done a phenomenal job providing a really holistic approach to how you're working on sustainability strategy, how you're developing forward, some of the challenges and how you've overcome them. So thank you so much on behalf of the team and all the audience to Andrés and Amina for your kind contribution today. We would like to just share one or two more quick slides of recommendations. If I could just move to the next one. Thank you very much, Renzo. One is, of course, and you'll see in the chat, we provided a link to looking more about the tool itself. You'll find this same link in that link as well. But if you want to go to gscaccelerator.org, you can learn a little bit more about the tool. You can sign up and you provide more information to your colleagues as needed as well. We'll be more than happy to find time for a conversation and to help you along with your sustainability journey more generally. On top of that, if I could just have the next slide, please, Renzo. Thank you. We, of course, are going to be hosting our friends and partners and members from around the world at our 49th IHF World Hospital Congress in Seoul 2026, a wonderful destination. On the 19th to the 22nd of October, you are free and interested in learning from your peers around the world, and we're going to have a track specifically on sustainability, we do strongly recommend that you join us there. And on top of that as well, just as a very last slide specifically to the Congress, is we are looking for more entries around our 8 award categories. It's a fantastic way to highlight the work you're doing on sustainability and hospital processes more widely. So we really appreciate if you take a look at some of those award categories and make an application, and we would love to evaluate, and hopefully you'll be a winner. And the very last thing we just want to mention is, of course, at any time, please get in contact with us, follow us, connect with us online. I believe most of the individuals who would have came into this call today would have been coming through some of the online network and rather some of the online work we've done to build this community around sustainability. We'll definitely have more webinars in this series. We have one coming up, I believe, in early June. We're looking forward to welcoming you back and learning more from you as we help support you on your sustainability journey. So thank you very much, everyone. Have a lovely day, morning, evening ahead, and we look forward to helping you further along as we move forward together on our journey. So thank you very much, everyone.
Thank you very much, Ryan, and Geneva Sustainability Center. Thank you.
Thank you so much.
Pleasure to have you. Pleasure. Thank you very much, everyone. Bye-bye.